So Gifty and I both have this little tool in our offices, and this is, you know, an Allergan little booklet that they've given us, but this is a perfect example of, you know, a mom and a daughter, and you can see their bone structure is very similar, but the mom is 71, the daughter is 34. So you can see, and you can even tell our patients, you know, when you're looking in the mirror, we can see, you know, your bones kind of becoming more set back. You're losing the fat pads in your face. Your face, you know, all those fat pads in our face are a sign of youth. Just like when we were young, you know, we had nice big cheeks, and as we age, those slowly start to settle down. We can tell our patients that, you know, look at your mom, look at your dad, look at your grandma. That is your DNA. That is how your body is likely going to age. So if your mom has a very deep wrinkle here and she's never had any Botox, that's what you're bound to look like. So starting and doing more preventative treatments like Botox, even like fillers, will help you prevent those deep wrinkles from forming. So perfect example, the daughter is very young, has amazing bone structure. The mom also has great bone structure, but you can see her nasolabial folds, you can see her marionette lines here, you can see her wrinkles around her eyes or her crow's feet. So having the patient look at this and say, this is the normal process for aging, and you came in to me to see us talking about these lines, look, these lines are normal. This is the aging process. We like to show them this photo because as we're young, we have this triangle that goes this way. So you have like the peaks of your cheeks and you have your chin. As we age, the triangle turns upside down. So we start to get that heaviness in our jaw, the jowling, all normal, a normal process of aging. But once showing people these triangles, they can recognize that in their own face. Yeah, this is kind of what we talked about here. The signs of aging, we're noticing lines and wrinkles, drooping in the cheeks, nasolabial folds, marionette lines, jowling. And then this is a great photo to show if we are doing consultations for fillers, because these are the fat pads that are in our face. And you know, adding structure in our cheeks and adding structure in our jaw and our chin make a lot of impact, because as we lose the bone density in our mid-face, our skin will start to sag and start to slowly droop. So adding structure up here is actually going to help tighten that skin. Gifty and I talk a lot about patients who come in with this issue, the nasolabial folds. It's so common, but you have to kind of consult with the patient and see where they're at, because sometimes they can see the bigger picture and they can see, okay, these lines are actually caused because of our cheeks slowly falling. So they can understand that if we add more to their cheeks, that's going to really help those lines. Whereas some people, if we talk about this and address this, still all they're focused on is this. And if, you know, I've done a consultation where, you know, a woman came in for nasolabial folds. I recommended cheeks and it looked amazing. She came back in 2 weeks and said, this didn't work. I still have the lines. And maybe in that case, just doing a better assessment and really understanding where she's coming from. If I would have, this is more advanced than doing this. So in understanding where she's at, maybe just doing a little filler here, even though it's not going to last as long, it's not going to be as preventative as doing this. This is what she could grasp at that moment, and maybe addressing that would have been more appropriate for her. Let's see. this is a really good picture of all of the muscles in our face. So anytime we're doing Botox, especially for people with who are neurotoxin naive, they've never had any treatment, it's cool to kind of show them exactly what muscles we're treating, because some people will know absolutely nothing. They've never had toxin, they've never had fillers, but they'll come in and say, I don't like, this. Can you like put Botox here? And I tell them, if we put Botox there, look at all of these intersecting muscles here. These are the muscles that help us smile and to help us talk and to help us eat. If we went in and relaxed those muscles there, that would just like leave you to, that is not a place we want to put Botox. So even with people who come in and say, these lines bug me, but these don't. We know that these muscle fibers are intersecting and they depend on each other. So if we just use Botox in their forehead without addressing their glabella complex, this will make these wrinkles disappear and you will have this nice shiny forehead, but you'll have a nice rainbow here with the glabella complex kicking in stronger, and you'll get a nice bulge. That will make it so that your Botox is very obvious. So people want this toxin treatment to help with the wrinkles and to help, a lot of people don't want anything too crazy. They just want subtle relaxation of their muscles. But if we go in and treat this muscle without treating this, people will know you have Botox, because you're going to have this nice bulge here with all those wrinkles still intact and then these wrinkles gone. It's more obvious if we treat one or the other versus when we treat them all together. It has a more aesthetically pleasing look. And still vice versa. If someone comes in and says, these lines bug me, I don't care about these lines. Perfect, let's treat these lines, but maybe add a little bit up here too to address some of those wrinkles to stabilize that muscle, because we can go in and relax that muscle. And same thing, we'll have relaxation of that whole muscle in a nice little rainbow, but around the top, the frontalis muscles are not going to be relaxed. They're going to even compensate and kick in a little stronger, and you'll have this nice wave of muscles around here. But yeah, ripples, but like no wrinkles in the middle. So education on that is super important. Even if they come in saying, this is what I want, we need to see the bigger picture and say, I know this is what you want, but in order to get you the results that you are looking for, we need to stabilize these muscles too. So using the tools that you have back there kind of gives the patient a better understanding, because we're all nurses here. We know basics of anatomy, but our patients don't, and they don't. Having something for them to look at like this really helps. Yeah, this is a perfect booklet because it addresses the fat pads, it addresses the muscles, and it addresses the bone structure. So in teaching people about the aging process in our bones, these bones, as we age, slowly start to become more set back because of osteoporosis. We're going to lose that bone density. So that is what adds structure to our face. And when we lose that, that's why our skin that's how our skin starts to sag. So really addressing the bone structure and adding fillers up in our cheeks, chin, can make a big impact in the tightening of our skin. I heard someone say this, and I will tell everyone this, that our face or our skin is like a tablecloth, and underneath the tablecloth is like our bone structure. So as our table gets smaller when we are aging, our skin is not going to get smaller. So in doing things like tucking the skin back here by pulling it more taut with that tablecloth, that can make a really big impact. Does that make sense? Mm-hmm. Someone said that, and now I will use that in my consultation. Or even, I like this birthday cake analogy, that if we're making a cake, the inside of the cake is fillers and things that we can add underneath the skin to, build volume, to relax muscles. But the icing on the cake is what everyone sees, and that's our skin, that's skincare. So if people come in and they want to throw so much money at fillers and Botox, even if our wrinkles are relaxed and our bone structure looks good, if our skin doesn't look good, you're not going to get the best impact. So always addressing that skin care is so important. Gifty is really good about navigating that, and when people come in and say, hey, let's do my lips again, let's do my lips, just slowly encouraging them to get facials. Take care of your skin, because your Botox is not going to settle as good as it possibly could if you're not taking care of your skin.